Now here with the latest COVID headlines, Dr. Jeffrey Sterling. He's the founder of Simcoe, Illinois, Managed Preventative Healthcare. Hi, Dr. Sterling.
Well, hello. Hope you are well and being safe.
And you too. It's good to see you, Dr. Sterling. And you know, we've got to start with this because I know that you were of the opinion that we took the masks off too soon. Now
Yes.
the masks are coming back, at least in Chicago, mandated indoors. Is that enough with what we're seeing with these cases right now?
No, actually, it isn't. And I'll just start by pointing out that there are three parts to this cocktail of prevention that we need to be engaged in. You socially distance to avoid being in the range of transmission. You mask up really to avoid transmitting to others, and you get vaccinated to prevent yourself from dying from COVID-19. So all three of those things really need to be at effective levels before we can actually feel good about turning the corner and being safe individually and collectively.
For those of us who are vaccinated, how concerned should we be about the waning efficacy of the vaccines? As you know, booster shots will be happening. They were authorized for folks starting next month. Should we be concerned right now if you're vaccinated?
You should be concerned. You shouldn't be worried. The truth of the matter is that there's a relative scale and an absolute scale. As a relative consideration, yes, there's waning. But on an absolute scale, we still are very effective in terms of being able to avoid the infection. Actually, according to the CDC, vaccine effectiveness was 92% prior to the emergence of the Delta variant. And now it's down to about 64%, which still gets us there. The good news is that if you actually get the booster once it becomes available, it actually is bumping up your antibodies tenfold. So we're just really trying to head this off at the pass before you get so low that you individually become more susceptible to this. And in other parts of the world, specifically Israel, which has been doing a lot of research on this and whose efforts actually predated our own, they actually are just now starting to see that waning level become low enough to where it's resulting in increased hospitalizations amongst the vaccinated. So far we're okay. I just really do appreciate the fact that we're trying to be ahead of things at this point instead of waiting for the next wave to take hold before we start taking action again.
And what are your thoughts on this third booster shot? Is it selfish of us as a country to authorize the third shot when there are so many countries in other parts of the world where people have not even been able to have access to their first COVID-19 vaccine?
I really have to say that that's not fair. It's not a both. It's not an either or proposition. It's really a both and. The United States has actually donated more vaccines to other countries around the world than the rest of the world has actually been able to produce on their own. And America really is looking out for its citizens, which is its primary responsibility. So we're proving that we can be good citizens of the world, but we have to reasonably take care of ourselves, because back when the waves were crashing around the United States, we were literally the epicenter of this disease. So giving boosters to make sure that we are safe at home while we're still doing more than any other country around the world and donating vaccines to the rest of the world, I think the balance is correct and is actually appropriate. And I don't think that we should be shamed into thinking that we should be without, because really in order to protect ourselves optimally, we have to do both, not either.
Okay, so let's talk about the kids. Going back to school, hard to believe. Summer is over, almost over, winding down. Some kids already in school, others will be heading back. I know Chicago Public School students will be back on the 30th. Masks mandated in the state of Illinois, but still a lot of pushback from some parents who don't want their kids to have to wear masks all day in school. And you say what to that?
Well, I think that reasonable concerns are a good thing. Irrational fears are not. So the criticism of not wanting your kid to wear a mask in school, and nobody criticizes when you wear a mask on Halloween or when you're playing, and we're doing this to avoid death. And we're in the midst of a pandemic. We kind of have to get over ourselves and really be mindful that extraordinary times call for extraordinary measures. But even that is not enough. The warning signs are flashing, and we really do need to take heed. in order for kids to go safely back to school, it's a massive endeavor that's being attempted here because no one under 12 at this point is able to be vaccinated. So asymptomatic carriers is a thing, and inasmuch as kids can be carriers, bringing those viruses back home where they can spread to people who are susceptible, that's something that we should be concerned about. And if we're going to try to return kids to school, we really have to follow the CDC guidelines to a T. There needs to be distancing. There needs to be mask wearing. And just as soon as possible, soon as feasible, we need to make sure that the kids are vaccinated. And certainly we need to make sure that all the other teachers and staff are also vaccinated. So there's a lot to this, and it's a massive undertaking. I really applaud the sentiment behind the effort, but if it is not done precisely, this is not going to end well.
A lot to think about there. Dr. Jeffrey Sterling, thank you so much for your expertise today.
Always good being with you. Be well.
You too. And there is a free community health clinic on Saturday, August 28th from 10 until noon. You can get a COVID-19 vaccine right there. The link to register will be on our website. You can find that at WGNTV.com and more information on your screen.